is doing this early morning, and we just want to wrap traffic this morning. Also just gave you some alternative routes, especially for those that are using this specific road as you're going about your businesses in the city center. But at least as of now, it is quite manageable, not looking so bad, and that is what is happening along Valley Road as well as Agwix Kodak Road.
Thank you very much, Doreen, for that detailed update as to what is happening on our major roads. And now that brings us to our interactive segment this morning, and we're going to be having a one-on-one session with frontline workers who are dealing with the COVID-19 pandemic from the different areas, different parts of the country, as well in different capacity. Joining us this morning, our first guest live is Roslyn Kagwe, who is the Director of Public Health in Embu County and is in charge of COVID-19 emergency operations in Embu County. Good morning, Rosaline.
Good morning, madam.
Great to have you on board, and thank you for your time. Now, talking about the state of preparedness of Embu County, what is the county's capacity so far to deal with COVID-19?
I would say that Embu County is prepared. We have all the capacity to deal with COVID-19, other than just a few hiccups which are very common in any other county.
How about you just give us a detailed report? We are expecting, the president has convened a meeting between governors that is scheduled for Friday, and Kenyans are really expectant as to what decision that, the executive head of this country is going to take in regard to COVID-19 and the state of preparedness within the counties. You have said that Embu County is prepared, but how prepared is Embu County? How many ICU beds do you have? How many isolation centers do you have? And as well as how many ventilators are we talking about?
We have set aside isolation units with a capacity of 324 beds so far. We have 10 ventilators and 7 monitors so far. We've also been able to sensitize healthcare workers, the frontline healthcare workers, on prevention, on IPC, on COVID in general. And this is about 3/4 or 75% of healthcare workers in Embu County.
Very well
we
said.
Have also been...
No, continue. Sorry for that.
Okay, I want to say that we've also been able to create awareness to the general public. This is about 200,000 members of public. We've also been able to sensitize stakeholders and partners, including clergy. We've also been able to meet organized groups like the security team, so that the message on COVID-19 is trickled down to Wajiko. And this includes the community health volunteers and also the Nyumba Kumi initiative.
Now, speaking about, the public, how are, Embu County constituents actually, are they adhering to this laid down safety protocols in as far as COVID-19? Because we've been receiving reports from various parts of the country that Kenyans, a majority of Kenyans either are not masking properly, they're not sanitizing as they should, and they are not, just maintaining social distancing.
Okay, let me say that amidst other challenges, enforcement has been well done in Embu County. But what I would say is behavior change is gradual. So we are still enforcing the same through the security teams, but I may say the members of public are not wearing masks up to 100%. Of course, we can't miss those who are not really implementing. But I would want to say that Embu County is totally following all the guidelines from the Ministry of Health and implementing.
Embu County falls in a mountainous region, and cold temperatures currently being experienced. From where you sit, are you foreseeing complications going forward? Because the reports that we're getting is that counties are bracing. Like we had a very catchy and also morbid kind of headline yesterday, as counties prepare, or rather are buying more body bags, ahead of the storm. What's your take being within county, Nairobi, Embu County, and looking at, at its geographical placing and its issues of whether the cold and such that has been told, it can actually exacerbate the issue of COVID-19?
Yes, I agree with you, Madam. We are likely to have a surge. Though Embu County has only 2 confirmed cases, we have several suspected cases. That's about 6 in our isolation units. And this is not usual because for the last 1 month, we've not had many exposed or suspected cases. But as of this week, since Monday, we've started receiving suspected cases who have been exposed following the reopening of the economy. I would want to say that we need to be fully prepared, just like you said, with the body bags, because anything is possible. We are having body deaths, home deaths, but it's not necessarily that it's linked to COVID-19, but that's a stern warning that we need to be fully prepared.
Very well said. Now, going forward, what are you doing as a Director of Public Health in Embu County to just stem the issue of stigma, especially for those who, may have recovered from COVID-19? Issue of stigma and COVID-19. How are you dealing with it?
Thank you, Madam. I want to say that stigma is real, not just the members of public, even to the healthcare workers. And I am just basing this to the fact that COVID-19 is a new disease which we are all learning and adhering to updates and directives. I want to say that through behavior change communication, through sensitization, through a lot of awareness creation, we are able to curb that problem. It's a challenge. And let me also say that in our health setup, we have counselors who are trying to talk to especially the patients because of stigma. And also we have officers who are trained on risk communication. Through risk communication and community engagement, we are able to win people and they are getting to know that COVID-19 is a reality. And in a way, though the behavior change is gradual, we are reducing stigma in Embu County. And from the start, the way it was when we started is not the way we are today. We have seen some changes. People are really now taking it real, and we really appreciate them.
Now, as far as public health is concerned, there have been a lot of criticism about, how various health centers are dealing with patients who come in exhibiting COVID-19 symptoms. Some of them have been saying that they have been turned away. Others have been saying that instead of being treated, we don't have a cure for COVID-19, but other underlying issues are not put, you are looked of as a leper per se, and you're seeking medical attention in various public health centers, but, also private health centers. What is your take in this regard?
Let me say that because of the training which we have done among us healthcare workers, and the early setting of isolation centers in Embu County, that has not been a case. It has not happened. No one has been neglected in any health facility in Embu County. But instead, they have always been, because we are working together as a team, they have always been consulting, and especially when we get suspected cases. This one has been made possible by the triaging system in our health facilities, whereby anybody getting health services in our health facilities in Embu County is screened, and triaging takes place. So we have not experienced that in Embu County. Thank you.
Do you have a plan B in the event of, the laid down measures that you have put in place and the capacity that you have is somewhat overwhelmed? Do you have a plan B in place?
Yes, our plan B is to extend the isolation centers in other facilities. Currently, we have them in level 3 and 4, level 4 and 5, sorry, and we are expanding the same to level 3s, looking for space and setting up an isolation center in all those level 3 facilities.
Now, Rosalind Kago, thank you for that update in regard to the state of preparedness in as far as Embu County is concerned. You're the Director of Public Health in Embu County. But before I let you go, I'd want you to take a listen in into Health Cabinet Secretary Mutahi Kagwe.
First one, number one, is Rosaline Kaugi. Rosaline, thank you very much. He is in charge of emergency. Maybe you better stand here so that the media can, you look at the media, face the media so they can see you. I think they much prefer to take your picture than mine. She is in charge of emergency and operations of COVID-19. She coordinates the county and 4 sub-county response teams. She further coordinates 37 multidisciplinary subcommittees on COVID-19 within the county on preventive services tirelessly.
Indeed, Madam Kaugi, were you expecting that, and how did that make you feel?
I least expected that, but I felt so well. I appreciated, and I really appreciated the frontline healthcare workers in Embu County, because they are. We work as a team, and they are very dedicated and committed, and that led to the recognition.
So from where you sit, is Embu County ready and capable of dealing with any eventuality that COVID-19 may push its way?
I would say yes, because of the current situation in Embu County, the current engagement with all frontline healthcare workers in matters of sensitization and how to handle a COVID patient, the presence of guidelines, and also the capacity in the training. The HR, they are very well trained and they are committed. Mm-hmm. So in case of any eventuality, we are ready to handle COVID-19 with a lot of support from the Ministry of Health, because on our own as Embu County government, we may not make it. We are also relying in some help or some support from the national government. And I want to be very specific. In matters laboratory, we are relying on NIC, the National Information Center, and the Cambridge for testing. So if the same is extended to us at our level, the county, we will really be prepared. Another thing we would really want to request the national government is to add the human resource on handling, because so far we are extending the isolation centers, and extending means we need more healthcare workers trained on COVID-19 to handle the cases. More so in our ICU and HDU, we still need more capacity to handle as we move to the surge if it happens in Embu County. Mm-hmm. Thank you.
Very well said. Thank you very much, Rosaline Kauge there, who's the Director of Public Health in Embu County and is also in charge of COVID-19 emergency operations in Embu County. Thank you, Madam. Thank you for your time. Now, just to give a recap and a take home in regard to how Embu County is preparing itself for a surge in COVID-19, given the current numbers that we're seeing, is that Embu County has an isolation unit with 324 beds, as well as 10 ventilators at the moment and 7 monitors. Then the Embu County has already conducted sensitization of workers as well as the public to around 200,000 of those cases. At the same time, also a call there by by Rosaline Kauge, who says that the government needs to add human resources, especially in light of where we are heading as far as COVID-19 infections are concerned. How about we have a listen in before we introduce our next guest this morning on our one-on-one with frontline workers who are handling COVID-19.
The second one is Dr. Kwalib Ali Abdi. Daktari, medical officer working in critical care department at Embu Level 5 Hospital. He is a trainer of trainers on COVID-19 and has been tirelessly involved in training of some 1,562 healthcare workers. And I can tell you, Abdi, that your passion comes through. Even when you are explaining to me about what is happening in the hospital, your passion comes through. Thank you very much for your help.
Our guest this morning. Good morning, Dr. Khalib Ali Abdi. How are you?
Fine, thank you, Jane. Good morning.
Great. I'm doing well. I'd want to know, after you got that recognition from the Health Cabinet Secretary Mutahi Kagwe there, what did you think about that?
It was very motivating. Actually, I didn't expect it. I've been handling the training of healthcare workers, and especially in the private and also our government hospitals, stemming back up to the sub-county and also our main hospital, Embu Level 5. So I didn't expect that I'll be recognized. So it was a bit moving, and I felt good, actually.
And are you satisfied with the current progress that you have made in training, frontline workers, especially within the critical care sector?
Yes, actually, I've managed to train more than 1,500 healthcare workers, both in private and also the government hospitals. And I've seen actually it trickling down in terms of the behavior change, the way we have been able to handle cases without panic. Training is very important. At least it helps in terms of removing fear and also at least making sure that your patient is also handled well.
There's been quite a debate, on the arrival of Cuban doctors back in the country to just, scale up capacity as far, as medical issue is concerned. What's your take? What's your doctor's take?
My take is actually we need to exhaust our human resource available. Kenyan doctors are actually well trained in terms of handling the surge at the moment of COVID-19. So I'll advise the government actually to first of all exhaust the human resource available, and then in case maybe if we are overwhelmed, then maybe we can consider getting help elsewhere. And in terms of speciality, we do have enough specialists, infectious disease specialists, and also medical officers who are well versed in terms of matters of training. And Kenya is a country which is very lucky in terms of even the junior doctors are well versed in terms of handling everything. Basically in terms of maybe surgical practices and matters ICU. Like in my case, I work in the ICU at the Embu Level 5. I'm a medical officer, not a specialist, but I'm able to handle patients by the mentorship actually given by my seniors. So it's possible to use our own resources, and in case we are overwhelmed, that's when we can consider maybe borrowing doctors elsewhere. So that's my take.
So what I'm hearing from you, Daktari, is that Kenya's human resource is still well capable of handling any surge so far, and that you think the government jumped the gun on this particular issue, and they should have given the local health practitioners an opportunity to continue rendering these services?
I can say that the government is also advised by medics like me, who are more experienced. Maybe they did some searching, and maybe there is a reason as why they are considering that setup. But I consider what I'm saying is that there are doctors out there who might come in handy in terms of handling the emergency in different aspects.
Now, Daktari, okay, thank you very much. Now, Daktari, how about you demystify for us something that has been going around, and just would want you to just give us the fact. When we first confirmed the COVID-19 case in March, there's been talk that if you go through a ventilator, you might not just actually, if you're put on ventilator, you might not survive the ordeal. Having handled or rather worked within, the critical department, is this so, or is just this a myth, a misrepresentation of exactly what critical care is all about in as far as COVID-19 is concerned?
Okay, on the aspect of handling COVID-19 patients in ICU, in Embu, we only had two confirmed cases. So in terms of ICU, what I can share with you is maybe the data out there. It has been shown that 38% of the patients will need ventilatory supports. 38% of them will succumb. So owing to the fact that majority of these patients, maybe they have other comorbid conditions, they are critically ill. So sometimes there are also effects associated with even the ventilators in terms of barotrauma, and it's an invasive thing. You have to put a tube inside the patient's lung, and then that might even introduce infections. But on the other aspect, it's a win-win situation. So some patients will benefit depending on the ventilator. I can say that it's the ventilator which is killing the patient because you don't have any other choice. So if you don't put the patient on a further support, then the patient at the end will have to die. So there have been some benefits in terms of medications which have shown also benefits in terms of patients improving on the ventilators, like a medication called dexamethasone, which has shown that there is some improvement which a critical care patient can also get in terms of that. So my take is, if a patient needs ventilator, it's important for you to consider putting the patient on the ventilator. And in case maybe you don't put the patient on the ventilator, they will end up still dying.
Very well said. Now, before I let you go, there have been allegations left, right, and center, laid at the door of, public and private health facilities, with persons seeking medical services saying, or rather pointing fingers at the issue of negligence as a doctor, Hippocratic oath and such. What is your take in regard to such allegations?
Actually, my take is it's very important for a hospital, be it private or government hospital, to have a good triaging system in a way that you should make sure that the personal protective equipments are available, and then you have a situation whereby you can screen your patient, cohort them, in case maybe there are some who maybe might fit the working case definition of a suspect. Then it's important for them to be handled by the healthcare workers in proper regalia. So in case maybe there is no such system, then it can be very difficult for maybe the doctors, nurses, or clinic officers, or the frontline healthcare workers to handle that patient. Like in our case in EMBU Level 5, what we have done is we have made sure that at least there is a specific group in terms of triaging such cases, and they are given all the personal protective equipment in case maybe we have a suspect that fits let's say, a suspected case of COVID-19. And then they are handled very fast, taken to the isolation, and the patient is also tried to be assisted in terms of understanding what's going on and how he or she should be handled, so that to prevent depression, stigma, and what have you, that is also associated with COVID-19. So my take is it's important for us to at least make sure that we have all the set systems at our triaging places, so that at least we don't let patients out there who maybe some might need oxygen as such, and maybe if they're handled faster, maybe they will be alive.
Now, as we come to a close and I let you go, Daktari, is in light of the current trend that we're seeing, according to data from the Ministry of Health, is that Kenya might be getting to a peak as far as COVID-19 infections are concerned, late August, early September. Are counties ready? Is our medical, or rather our healthcare system as a country, ready to deal with this eventuality, if and then and when it happens?
Actually, the president had given the guideline to the county governments to make sure at least the number of beds surpass 300 for isolation, and we have capacities to handle critical care patients in terms of high dependency unit and also ICU. In the case of, let me just use in the case of the county that I work in the case of EMBU Level 5, also the hospital that I work in, we have set ICU beds, HDU, and isolation unit. The major challenge is actually on human resource. So human resource actually might be a problem in case maybe the case is such. In terms of infrastructure-wise, we are set. So in terms of handling very few numbers, I can't extrapolate how many, but what I'm trying to say is there might be increase in numbers. So even it will reach a time maybe where handling patients in the hospitals will be a challenge. That's why maybe you might need to consider home-based care. Like in the case of Italy, which was overwhelmed, you found a way that maybe some patients were not even being admitted to hospitals because of lack of space. So the way to go is make sure that we address the issue of human resource, and we'll have to make sure at least we also bring the issue of home-based care, and for people to at least understand. And in case of places that maybe home-based care is not possible to, in terms of homes which don't fit the home-based care criteria, then we should think of institutions which can be turned to communal home-based care system. But in our case, if maybe now we have cases in EMBU, we are able to manage. But if they increase, then such elements that I had told you in terms of human resource needs to be addressed, and we should start with our Kenyan doctors.
Thank you very much, Dr. Halib Ali Abdi, working currently as a medical officer as well as charge of the critical care department. Thank you very much for your time. How about we take a sneak peek into what is next?
I also want to recognize Molly Jue. Where is Molly? Molly, karibu. And Molly is a nursing officer in charge of Embu Level 5 Isolation Center. For her effectiveness in managing the isolation center, Molly, thank you so much.
Thank you very much there, Molly Joy, for joining us in this conversation this morning as we're having a one-on-one with COVID-19 warriors. After that particular recognition, what was your feel when you were, mentioned alongside other frontline workers who have done something remarkable for Embu County?
Wow, it was quite a good thing. Only that I didn't expect it.
So it was unexpected.
And I owe all of that to the team we work with, because they have been very supportive and they have made me come this far.
So in your role as a supervising nursing services, exactly maybe take us through exactly what your duties are.
Oh, my duties are being the team leader of the group, or the in charge of the group. So I oversee the nursing services and the activities of the unit goes on effectively. I also do multidisciplinary team coordination so that the patient can get holistic care. So I team up with the medical team, the nutrition for the patients, the patient's food and the patient's welfare. I also team up with the cleaning services. We also team up with the psychosocial support for the patient, because sometimes even when the nurse is trained as a counselor, you feel you're getting overwhelmed, so you feel you need the psychosocial trained counselors to assist. And they have come quite well in handy to help us, and they have been very supportive, because they also counsel the patient, they also counsel the staff, so they give us the morale to continue going and serving the patient.
Now, the Kenya National Union of Nurses, the body has been saying that it is not satisfied in the way nurses are, basically nurses are not receiving fair treatment, especially in as far as, their salaries and wages are concerned, in comparison to doctors and such. Do you feel that, there's a disparity when it comes, between, how doctors and nurses are treated?
Okay, in the treatment of nurses, we feel we are not being treated well and we should be given better remunerations. But nursing being a call, we have always come in handy to assist patient. But we feel the government should come in handy and give us better remunerations.
As a person as a nurse who happens to be, on the front line, the issue of PPEs has come in handy now with, just a report that indicates that over 500 health workers have been exposed to COVID-19. What is your take in regard to just, the personal, safety equipment being availed within the county level, or rather devolved units? Are you satisfied with what you are receiving?
Okay, we feel we should receive more, but one thing we have come to understand is that a pandemic is not an emergency. So if I'm not supplied the required PPEs, they should first be supplied for me to attend to the patient. So if they are not supplied, I can't attend to the patient. But if they are supplied, I'm always willing to support the patient. And in our county, they have always worked very well that they supply them for the patient when they are needed.
Now, I'd want to have your take in regard to just how you are handling the stress and anxiety, that has come up with this issue of COVID-19, bearing in mind the issue of stigmatization and the level of exposure of you being a nurse and frontline worker. How are you handling the stress and anxiety?
Okay, being a health worker and COVID-19 being a new disease, and all what it has come to, that nobody was prepared for it. Now what has come handy is that we first received training, so we became aware what COVID is and how we should protect ourselves. Then through sensitization even of the other staffs, they have also been supportive. Though stigma has been there, we have, working as a team, has helped us, even sensitizing other staffs that they need to support us and they need to know that being in isolation is not that you are isolated. They also need to support us, and also working hand in hand with the psychosocial counselors in the hospital. That has helped us. Like we have one of the psychosocial counselors, Rusi Nyaga, who has been helpful. She has come to help us with the staffs personally. She has also come hand in hand to support the patient, and she has also been willing. If you want to talk to her anytime, even through the phone, she has also been willing to assist us. So, teamwork, then consulting the psychosocial counselors, that has come quite handy, and it has helped us to cope.
Mm-hmm.
And also support from the administration has been very good.
In the public opinion court, there have been allegations that both public and private, health facilities, have been accused of negligence. And to just take you back to that conversation, you said that if you do not have the requisite, personal safety equipment, you would be skeptic to rendering your service as a nurse. In regard to these allegations, in regard, negligence in this public and also private health institutions, what is your take in that regard?
Okay, we have been feeding the neighboring public facilities, having some not working handy in handy, but we have consulted with the director and the CEC, and they have promised that they are going to talk to them and also sensitize them that they should also not just refer all the patients, they should also work in hand to support us in the COVID-19. It is teamwork. It's not a one-man show. We should all work in hand to fight this pandemic. So the county government has promised that they are going to talk to them, and we are expecting that they are going to change, and we are going to work hand in hand with them.
Mm-hmm. Thank you very much, Nurse Molly Joy, who's the supervising of nursing, and nursing services, coordinating nursing services in the isolation center. She's also an ophthalmic nurse, saying that indeed that it is teamwork to ensure that things remain smooth sailing in light of increased cases of COVID-19. Just to give us a summary of how prepared Embu County is, that so far they have isolation units with 324 beds, 10 ventilators, 7 monitors so far, and sensitization of health workers has also been attained, as well as just issues of the general public. In regards to the adherence of the laid down safety protocols, our earlier guest Rosalind Kauge said that she's conducting issues of public awareness have taken center stage, and she's seeing that Kenyans, or rather constituents of Embu County, are adhering to the laid down protocols. In regard to the preparedness, come the rising numbers, or rather what we're expecting over the next few weeks in regard to just the surging numbers that we have. Dr. Halib Abdi says that they are ready in that capacity, and that Plan B is in place to ensure that Kenya's medical system, especially within Kembu County, is not overwhelmed. Now let us have a sneak peek onto the next clip.
I also wish to recognize Derek Munene. Derek Munene, driver. He's an ambulance driver. Munene, asante sana. Munene is an ambulance driver in Embu Level 5 Hospital, and he took the response team to evacuate the very first case recorded in Embu County without fear, but I hope you had a mask on.
Introducing Derek Munene. Good morning and thank you for your time.
Good morning to you.
Great. Just tell us how you feel. What was your immediate reaction when you heard your name being called out by Health Cabinet Secretary there, Mutahi Kagwe?
At first, I didn't expect that, but due to the training that I received, the commitment that I had, I definitely wanted to appreciate the recognition.
Mm-hmm. Now, those who do not know Derek Munene, how about you just introduce yourself and tell us what you do in as far as, the value chain, what you're calling, we're having one-on-one with COVID-19 frontline workers who we are referring to as warriors. How about you just shed light into your day-to-day duties in this space?
To start with, I'm Derek Munene Jero. On the line of duty, I work as an ambulance driver, committed at the Embu 5 Hospital, and even work within the Embu County,
Mm-hmm. Now,
secondly, with the support of the county government, the Embu 5 staff, and the administration, working hand in hand to ensure that in the case I'm called, I'm there on time, and I'm providing with the right the equipment to enable me to attend to the patient as required.
Mm-hmm. Now, in light of your duties as a frontline worker, what are you doing to ensure that to safeguard yourself from exposure? Because I'm imagining if you're responding to an emergency, you really maybe do not have the full details in terms of the extent of the emergency that you are responding to. What do you do to ensure that you're safeguarding yourself from the risk of exposure?
Okay, when the coronavirus was announced in Kenya, I personally continued to receive a training on how to handle a suspected or a confirmed case on the coronavirus patient. First, we are taught on how to dress the PPEs that you are provided with on the time they are required. Therefore, whenever I'm called on a duty or to pick a patient, either from home or from another facility, I have to dress with my PPEs as provided from the hospital, and with the help of also a trained nurse who will also confirm that whatever that I've done when it comes to dressing, I'm fit toward the patient.
Mm-hmm. Now, Munene, I understand that you carried out the first evacuation of a COVID-19 patient. How about you just share your experience in that, given that COVID-19 is a pandemic that we do not have any prior information in regard to that. It seems.
Hamjambo Wakenya wenzangu. Mimi ni Mheshimiwa Mize. Ninalotaka kuambia ni kuwasihi ya kwamba corona iko. Na ili tupigane nayo na tuishinde. Ukikohoa, tafadhali kama una ile ya kujifunika ile tissue, weka mkono hapa. Kama ni chafya yako atyo na itabakia pale pale. Kama ni kukohoa yako koholea hapo. Na nakwambia tukizingatia sheria na tuitii, hii corona tutaishinda na nchi yetu tutarudi kama kawaida.
On the next episode,
Of nowhere, her son Ramon, and only heaven knows why he was in that house, threw himself at me. He was yelling and he just hit me and I am just an old woman who's defenseless against him.
Hortensia is pretending to be frail to take advantage of the situation. Shameless.
If she's blaming Ramon for something he never did, just imagine what else she can do.
She disappoints me more every day.
Now the only thing I can think of is I wish he had never come here.
Oh no, he's not the problem, my friend.
In Love with Ramon.
Good morning. If you're tuning in, this is KBC Channel 1 and Good Morning Kenya. And this morning on our interactive segment, we've been having a conversation with COVID warriors. Online was a driver, an ambulance driver that we call Munene. He was just telling us of his first evacuation experience. Munene, we have you back online. We wanted to share your experience on that first evacuation of a COVID-19 patient. What was your experience and what were your immediate thoughts when you had to do that particular evacuation?
As I was saying, at times it's become so difficult, and for me, at first, it was a challenge to me. But due to the training that I had received, I had to take courage, I had to volunteer, as I had promised that I had to do. Saving a person's life is a priority to me. So when I was called and informed of the case, I had to be dressed with the PPEs that I was provided with. I also wanted to ensure that I had what was required, the sanitizers, the mask, the gloves, and also to ensure that the nurse who accompanied me was also well dressed with the PPEs, and also positively and willing to accompany me to attend to the patient. Mm-hmm. First and foremost, once I met the patient, I had to ensure that he had the mask that was fully that was worn in the right way, and also to provide with the other gloves to ensure that he did not touch any part of the ambulance with the bare hands, whether from where he was sitting or even as he bonded to the ambulance. Mm-hmm. I also wanted to take the initiative to make sure that the ambulance I had to open the ambulance and ensure that the patient was safe from where he was sitting, and also the nurse who accompanied me was also well from where he was. Then, once I picked the patient, we had all to go all the way through to Emperor 5, where we ended the isolation, confidently knowing that what we did, we did the right thing and to the right person.
Mm-hmm. Now, on a personal scale, the issue of survival is for every human being as well as living creature. Why are you scared at that moment? Why are you scared?
Okay, first, coronavirus, it was announced in Kenya, it was a new disease. Secondly, when earlier on, there were no trainings that had been done before the COVID-19 disease was announced. Then after it was announced, that the time as the county government also took the initiative to train the staff, I being one of them. So if I had not received the training, actually I could not handle the patient the way I was supposed to do. But since no one was ready for that, or for the patient, I take the initiative from the knowledge that I had acquired. And since I never knew how is the patient is, how the patient is, was the patient able to walk, or was he to be lifted from where he was? So that was the fear. Is this person able to walk, or am I the person to lift up the patient to the ambulance?
Thank you very much, Damek Munene, there for sharing your experience. And you and the rest of every other person who we are terming as frontline workers in light of COVID-19 pandemic, you are heroes of our time, and we wish you all the best. And we hope you also take care of yourselves to just, risk the limit of exposure as you continue doing service to man and service to country. Thank you very much for your time. Doreen?
Thanks so much.